Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, my friends from Florida and all around the country. This is Lou Biasi. I'm with you tonight, and I wish you all a very happy and healthy holiday. You know, the theory of the show is live a longer and healthier life. Today, with COVID going on and with the new variant that's coming out, people, I want you to really make sure you get your shots. Please get your shots and make sure you get your booster shot, especially for you seniors and anybody that's vulnerable for getting this disease, because this disease is no joke. I mean, you could look around, your neighbors are getting this, people are getting, friends of mine just called me today, although they had their shots, they got COVID, but the symptoms aren't that bad when you have your shots. You know, tonight we don't have any major doctors guests. What I want to talk about is health care in general, what you're entitled to. You know, we just got over the enrollment period for Medicare Advantage plans. That ended December 7th. Now, what is happening at December 7th, you had up until the 7th to change your plan either to a straight Medicare or Medicare Advantage plan. Now, you know, I've been in this business over 40 years, and I try to advocate people to stay on straight Medicare. 90% of healthcare workers will tell you, stay on straight Medicare. The advantages that you have in straight Medicare, you'll see a lot of commercials telling you, you know, Joe Namath, all these athletes are telling you they're going to get this, you're going to get that. Here's the question. Are you going to get good care? Care is the most important thing. Yeah, you might go to the gym. You might go here. You might be able to they tell you you're going to get a home health aide. They tell you you're going to get free food. But what happens if you need good care? The question is, with Medicare, 99 out of 100 doctors carry Medicare. That means you can be anywhere in the country, anywhere, to go to any doctor that carries Medicare, and they'll accept your Medicare plan. Medicare Part A, Part B, Part D. I've been in this business, and people said to me, well, why aren't you on a Medicare Advantage plan? It's going to cost you a lot less. Really? How much less is it going to cost me? Between all the co-pays you're going to have to pay and all of this you're going to have to pay. But what's more important? A few extra dollars or my life? I treasure and value my life. So, you know, what I talked about, I talked to a friend of mine today who advised me that this Medicare Advantage plan, the enrollment period was off December 7th. But he also told me that you can get Obamacare, and I believe you can get Obamacare up to January 15th. So if you don't have any insurance right now, you can try to get enrolled in Obamacare. You know, that's basically what's available for you right now. And I use a gentleman by the name of Sandy Jacobson. Sandy been doing our insurance for the last 30 years, I think, 15, 20, 30 years. And Sandy can answer all your questions. I'm not an expert in insurance. I don't sell insurance. I don't advocate any particular company. But if you have a problem getting insurance, or you want to switch to your Medicare, you want to switch from Medicare Advantage to Medicare, or you need a supplement, a Medicare supplement, you can get a Medicare supplement anytime during the course of the year. I advise you to call Sandy Jacobson, a fantastic gentleman, very, very honest. Sandy's number is 561-450-6557. I'm going to give Sandy another plug because that's how good he is. 561-450-6557. 6557. I must have told about 40, 50 people, friends of mine, to call Sandy when they're ready to go on Medicare or something else. Everyone has come back and told me how wonderful of a gentleman this man is and how well he explained it to you. Explain the advantages and disadvantages, okay? I have a friend of mine. She called me up and says, I'm on a Medicare Advantage plan because I can't afford to be on Medicare. Well, her lady told her that it's going to cost her over $400 to $500 a month. Well, she got scared. And I said, call Sandy. So she called Sandy and says, that's not true. It's only going to cost you $190 a month based upon your income scale. So, again, the difference between Medicare, Medicare Advantage, and what you can get and what you can't get out of both policies, we're going to try to go over that tonight. Again, I'm an advocate, I'm going to tell you right up front, of straight Medicare. Why? Because I know if I get sick and I'm in Arizona, I'm in North Carolina, I'm in Massachusetts, I can go to any hospital, any doctor, they're happy to accept my Medicare. Example, I called for an appointment. I needed, at that particular time, I needed a rheumatologist. So I called a rheumatologist, and they said, well, first said I need an appointment. They said, well, the earliest appointment is 4 months. I said, yeah, but I got a great Medicare plan, a great supplemental. Well, let me look. Guess what? I have a cancellation tomorrow. Can you come in tomorrow? That's the difference. Why? Because doctors today realize that if you got Medicare, they're going to get paid a fair amount of money from Medicare. Also, there's a number of things that Medicare covers that a lot of people don't cover. Like, for instance, Medicare started, we just had a discussion today with my friend Clayton over here. Clayton is you're the compliance officer, aren't you, Clayton, for All County Healthcare? All County Healthcare, yeah. Right. And, compliance officer, what's that mean? Explain to me what a compliance officer does, Clayton.
In the home healthcare setting, we are regulated by these laws within the Medicare guidelines. They're called Stark and the anti-kickback laws. And so that is, we are regulated by how much we can spend per doctor. And this is a across-the-board set of regulations that regulates the entire industry.
And am I correct? We're one of the few companies that has a compliance officer on staff.
In the county, unless it's a pretty big agency, I don't know if they have one.
Okay. So that's why we try to say all county. All county has a 4.5-star rating. Am I correct?
We have a 4.5-star rating.
4.5-star rating with Medicare. Right, the most you go is 5. We got a 4.5. We got a 5-star rating as far as customer satisfaction. Correct?
Yeah, we do. There's a couple different ratings. There's from the Florida regulating bodies, and there's also Medicare, which is CMS.
Okay. What does that mean? That means that if you called Medicare and you said, I need a home care agency, I want home care, who do you suggest? Good chance I might tell you, call All County Healthcare. If you're in the Delray area, the Palm Beach area, or you're in basically Broward area, we cover 3 counties. We cover Palm Beach, Dade, Broward County. And we've been in business almost 40 years, Clayton.
Yeah.
About 40 years we've been in business. And to keep a 4.5-star rating, that's fantastic. So let me explain to you, folks out there, and if you have any questions, there's a call-in number. Freddie, what's that call-in number? Can you tell me? 888. The call-in number is 888-565-1470. 1470. Now, if you have any questions, I'll try to answer them. And if I can't, I will have the answer for you. If there's any question that you want to know and that I don't cover tonight, please call me at 954-717-7027. That's 954-717-7027. Ask for Lou Biasi, or ask for Clayton. Or for instance, and if they leave a message, tell them you want me to call you, I'll be happy to get back to you as soon as possible. Probably the same day or the next day. But we're going to cover some of the things that basically what Medicare covers as far as home care. And why is home care important? Well, for instance, we have a number of doctors that come on this radio show. It's called You and Your Doctor. And the reason why we have these doctors come on the radio show is we want you people to realize of what the young talent that's coming into Florida today, how magnificent they are, how this young talent that's coming out of the greatest universities, Harvard, Cornell, Columbia, whatever university at the top, they're migrating here to Florida. Why? The climate's great, the hospital is great, and there's a tremendous amount of senior citizen population in Florida, and it's growing every day. So a lot of my friends say, a friend of mine just had a shoulder done. If you listen to Jimmy had his shoulder done. And all his friends says, well, why are you having it done in Florida? You should go back to Boston. Jimmy says, let me tell you, we got the best doctors down here. He had his shoulder done down here. He's a Boston resident. He had his shoulder done down here. He had his hip down here. And his outcomes have been tremendous. So if you want to look at the doctors that we had on, please go to our website, WW County Healthcare, and look at what we say shows. You can view all the doctors that we had on. If you need a shoulder doctor, a hip doctor, a knee doctor, any kind of doctor that you have, we have brought the best of talent right on in the show. And with the results, what the people are saying, when they use these doctors, it's amazing, just amazing of what the outcomes are. So what is home care? Who's entitled to home care? Should I have home care or shouldn't I have home care? Now, Clayton, tell us a little about what home care basically is when it comes to the senior citizen or those that are 65 and over or totally this. Now, what that means is if you're in Medicare Part A, Part B, or you're disabled and you're on Medicare, you're entitled to be on Medicare Part A and Part B. And I believe, and I know for a fact, that service is free, correct, under Part A and Part B?
Yeah, it's one of the few services left under Medicare that is covered at 100%. And so after a person turns 65, or if they are deemed disabled by the government, they can go on disability Medicare, or you get your entitlement at the age of 65. And that is the traditional Medicare that Lou is alluding to about staying on your traditional Part A, Part B Medicare after you turn 65.
Now, what's the difference? I might get called on a carpet for this. What's the difference between Medicare Advantage? By Medicare Advantage, I mean those Humana plans, those Aetna plans, all those plans that are telling you what Joe Namath is on or this other gentleman is on. Listen, Medicare does not spend almost 5 cents on advertising. They spend 99 cents of their dollar or around that on you, the enrollee, to spend it on medicine. At one point, Medicare Advantage was spending 40 cents on medicine. 40% of their income was going on medicine. When Obamacare came in, they forced them to spend 80 cents on medicine. As a result, if you look, rates have gone up, skyrocketed, right? Why? Because they're trying to make up that differential. There was a company that the CEO walked out. Now, this is a tragedy. A doctor leaves his practice, he might get 1 year's salary. Maybe he'll get a year's salary, year and a half salary, after working 40 years. A gentleman who runs a Medicare Advantage company, his parachute program was $1.2 billion. Somewhere around there. I might be wrong, it might be $1 billion, $1.1 billion. It was $1.2 billion. Now, where in medicine can anybody walk out with $1.2 billion? I'd like to know. So, as I can tell you, you can go to any hospital. You can go to any doctor. Now, if you put into a facility, that means when you have a serious operation, for instance, a hip surgery or a knee surgery, sometimes the doctor will want to send you to rehab. Am I correct, Clayton? You might spend some time in rehab. So you might have a choice of what rehab area you should go. If you got Medicare, straight Medicare, you might have a choice to go to a fairly, I'm not talking about a rehab company. I'm not knocking any rehab company, but there's some good ones and there's some bad ones, right? There's good rehab company. We've got a lady right here that works for one. She'll tell you there's good ones and there's bad ones. What makes the difference of the good one and the bad ones? Well, guess what? You read about it in the paper. How many people died at that bad facility that had no nursing staff or don't have this? You got to find out what's best for you. One thing I'm telling you right now, please listen to me. Do not shortchange yourself on health care. I have a friend of mine that was a multi-millionaire. Not that he couldn't afford it. He didn't know. No one advocated for him. Because most people don't know. Or they don't want to know. Because they don't want to know until they get sick. I might get 3 to 4 calls a week. Lou, my mother just got sick. She's in the hospital. What can I do? What kind of insurance does she have? Well, she's on Medicare. Well, come to find out, she's not on Medicare. She's on a Medicare Advantage plan. Medicare, straight Medicare Part A and Part B is not the same as Medicare Advantage. Please get that into your head. Whatever the salesperson tells you, right? You might want to go buy a Cadillac, and he tries to sell you a Ford, right? He said the Ford is just as good as a Cadillac. Guess what? I want the Mercedes-Benz. That's why I have Medicare, straight Medicare Part A. It's the Rolls-Royce of any kind of health plan you can get. I don't care what it is. And you have, and they can call me, any one of those salesmen could call me and say, well, I heard your show, and I think, well, come on, talk to me. Let's get on the show together. Let's compare the two policies. Let's find out what the doctors say. I'm getting carried away here. I already got to just tell me I have to take a little break. So we're going to take a 30-second break. We'll be right back. Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Care always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. One of the things my people are just reminding me of, one of the things you have when you have straight Medicare, you have a choice. Choice. That's very important. Just like when you go to vote, you have a choice, right? On a Medicare Advantage plan, you have no choices. They're going to tell you where to go, what to do, who to see, what not to see. If you want to go see a doctor, you have to stay within the network. As a matter of fact, Clayton's going to tell you of a little incident that happened to us just recently about when a patient got discharged from us. Clayton, tell me what happened when that patient got discharged from the hospital, please.
Yeah. More generally speaking about patients in general, what I oftentimes I like to do is when people are making this decision whether to stay on traditional Medicare or to choose any type of Advantage plan, I always like to do this avatar scenario with them. And I tell them this is what I would do with my grandmother to illustrate the differences for her is, say you're a patient and you're of Medicare age, and we'll give two scenarios. You're a patient and you're on straight traditional Medicare. You go to the hospital and you get admitted. The doctor's looking at your insurance, and they're coming up with a plan for you, but he's not rushed to make a decision. He has 100 days that you can stay in the hospital and he can bill for services for you. Now, if we contrast that against the various Medicare HMOs that are out there, they are going to have a case manager who is at the corporate office, and they're going to be sending kind of follow-up progress reports, and they're going to be looking for data from the case manager within the hospital to determine when you need to be discharged. So someone's going to be intervening from the insurance company to tell your doctor when they should get those people out. And when we think about the discharge plan for these various patients, if you're on straight traditional Medicare, you're going to have the choice to go to whatever nursing home accepts your traditional Medicare, which is virtually all of them, as opposed to if you're on, say, a Humana or an Aetna plan, you're going to be forced to choose between the 2 or 3 that are in your county or the city where you live that accept that plan. The same thing goes for home health. In addition to, you're very limited by what that plan is going to provide. Again, a Humana plan, you're going to get the amount of visits that they tell you that you can get, as opposed to the traditional route. If you go to any agency that accepts your Part A Medicare, we're going to have an in-house case manager, and we're going to come up with a care plan for you, and you're going to get as many visits as you need within the Medicare guidelines.
So let's put that in plain English. I mean, I know Clayton he's not of Medicare age. He's a youngster. I'm Medicare age. I'm at Medicare. Let's put it in plain English. What it means is once you get into the hospital, the Medicare Advantage plan is trying to get you out of there as soon as possible. Why? It costs them money. They want to get you out of the hospital as soon as possible. We have a young lady here, and I know she's listening. She had a patient, a wound care patient. A wound care patient that could not be treated, should have been treated in the facility, but needed daily wound care. They came down and told her, we don't want them in the facility anymore. We want to back out to home care. Why? Because it's less money. Medicine is not medicine anymore, folks. It's money. M-O-N-Y, money. That's what it's all about. That's why you see all these doctors merging. I never seen so many cars on the road telling you they'll pick you up, they'll take you here, take you there. That wasn't medicine used to be. Medicine, the doctor used to come to your house and take care of you. The doctor would go to the hospital. Now they don't even go to the hospital anymore. They have what they call hospitalists that see you in the hospital. So when it's time to leave, they discharge you. Say, where's my doctor? Well, he'll be here shortly, right? So when Medicare Advantage comes out, so let's put it again, plain English. Medicine is money. And if you don't believe it, ask some of those people that have gone through it. How many people, Clayton, have you known, have come out of the hospital, came to home care, and were discharged too soon and automatically go back into the hospital?
Yeah, if you're referring to those patients that are on those HMO policies, it happens a lot.
Okay, that means they're discharged early, and what happens, they're either sent to a facility, the facility now has to transfer them back into the hospital, the facility gets dinged because they put them back into the hospital, the home care agency gets dinged, when all of a sudden it was the hospital that sent them out too early. All right, like Clayton said to you, when you're in Medicare home care, you're on a 60-day episode. That means you can stay on for 60 days, right? Then if you still have a problem, you're on for another 60 days. You could be on as long as you want, as long as Medicare will certify the fact that you need home care. Guess what? Those other companies, they don't want you on that long. They want you on as fast as they can go. Get off home care, get off this, get off that. And I get so many calls with poor people. They have no idea what's going on about their parents, their mother. What can I do? I said, I don't know what you can do. You could call the company, call the Social Security. You could try to change it back into. You got to change back into Medicare. Now, I don't know if we can change back into it. That's why you got to call Sandy. I'm not an expert. When can I go back and change it? I'm not happy with my health care plan. I'm not happy with the Humana. I'm not happy with the Aetna. I want to get off. Call Sandy. He'll tell you if you can or you can't. There's certain cases when you can or you can't. Now, what does home care do for you? Home care says, listen, you just had knee surgery. You're going to need therapy. You might need just physical therapy. You might need nursing because you have a wound. They take care of wound care. They do physical therapy. They do occupational therapy. They do speech therapy. We even do behavioral health today. It's one of the biggest problems with seniors with all this COVID and thing is behavioral health. People are depressed. Maybe you were depressed. Maybe you, for some reason, were depressed because you're going through this COVID period. You haven't seen your grandchildren. You haven't seen your children. They haven't seen you. It causes depression, right? Or you're out of work because you still have to work. You're a senior, but you still have to work and make some income. So my question again to you is when you have a choice, and you see these commercials on television, I wish you could just turn them off. Because those commercials, if you had, I guess, Clayton, let's tell them when Medicare came into existence. Medicare came into existence, if I'm correct, we had this conversation today. In 1963, I believe, under John Kennedy, and at that time it was the vice president happened to be John Kennedy and
Lyndon B. Johnson.
Lyndon B. Johnson. John Kennedy and Lyndon B. Johnson. When Kennedy passed away, Lyndon B. Johnson signed the Medicare plan. Medicare came into existence in 1963. It hasn't been there all that time. As you know, you're paying for Medicare every single time you get a paycheck. You're going to see money taken out of Medicare. So if money's being taken, you're paying for Medicare, why would you want to go to something else? You've already paid for it. It's like I'm paying for Cadillac, and the next thing, they're going to give me a Ford or a Jeep. Why can't I get my Cadillac? Because you decided not to, because you think you're going to save $20 or $25. They're telling me we only have a few more minutes. I think I got more than a few more minutes. I wish the show was an hour, because we could talk so long about this, and I think it's so important that you seniors out there know basically what to buy. Listen, when you're dealing with your health, don't look to save $15 or $20. Don't look to save $30. How important is your life? Mine's pretty important. I don't care what it costs me. I'm going to buy the best. Afford the best. If I have to get a second job, I want the best. But Medicare isn't that much more than any other plan. You can buy plans where there's no deductible. I go to my doctor right now. They don't charge me 1 single cent. I have no copays. I have no nothing. They go in. Thank you, Mr. Biasi. See us to 6 months. My college says see you 6 months. My primary says see you 6 months. Fine. And I can go there as many times as I want. So I'm going to end it by saying I really want to thank you all for listening. If you have any questions about this plan, give me a call at 954-717-7027. That's 954-717-7027. Just ask for Lou. And by the way, have a healthy, joyous Christmas and holiday. Please stay safe. We won't see you until after the new year. But please, again, stay safe. Get your shots. Get your COVID shots. Get your booster shot, please. Enjoy yourselves and have a healthy holiday. Thank you all.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers.